I think my first injury that really took me by surprise was at the end of my undergrad studies. I was at the University of Colorado Boulder, and I started having problems with tendinitis, just repetitive use. And the burning up my arm and the pain, and it would shoot up my elbow and everything. And all of a sudden, I was questioning my life path. First time around, I'm pretty sure that was the end of my musical career for a while. I actually let it hit me so hard that I just was like, I guess this isn't my path. And I shifted my focus from performing to music education. And the second time around, I just stuck with it. And I said, you know what, this feels like the path I'm supposed to be on. So I'm going to work it out. And it took a lot of effort and patience and maybe forgiveness on the days that I wasn't able to play, because I was like, I just want to practice. But when I was able to step back and shift my attention to other places, then I was able to heal and push through it, and it worked out great. He needed to use that and get pumped up, versus some other people need to steady and calm. And with that situation, I would say breathing is your very best tool. So some people need to pump up and some people need to calm down. And you have to figure out what works best with you and your physiology. Playing an instrument is character building, right? It's resilience building. And you're able to push through difficult things. You're able to be consistent. You're able to learn to be reliable and work towards goals, especially in the face of obstacles, right? Which is something you're going to do, whether you're in the business world or whether you're raising a family. It doesn't really matter. No matter what, you're going to need those character skills. I would just say, don't be afraid to learn about it and what you're going through also.
All right, welcome back to the show, everybody. Today I'm really excited to introduce another guest of mine who was introduced to me by my Aunt Nicole, actually. She's very well connected here in the Utah area, so she sent me quite a few references that we'll all get to know throughout the course of this show. But my guest today is an oboist in the Utah and Salt Lake County areas. She runs her own private studio and also plays with the orchestra at Temple Square up in Salt Lake City that plays with the Tabernacle Choir at Temple Square every Sunday. And she has compiled a resource file for musicians who have gone through injury that we'll talk about here in a second. But I'm really excited to talk to her today and share her insights with you guys. And Dr. Erika Bright, welcome to the show.
Thanks. Hi.
Hi. Yeah, we're going to have a lot of fun today. But like I said before, off camera, I like to just dive in with my guests and have them share their experience, their personal experience with injury. And so if you want to just go into like how your injury happened and then kind of the circumstances surrounding that.
It's funny because when you asked about one specific injury, I could not narrow it down.
Oh, really?
I'm kind of old. So there's different injuries in different phases of my career. The one that I think my first injury that really took me by surprise was at the end of my undergrad studies. I was at the University of Colorado Boulder, and I started having problems with tendinitis, just repetitive use. And the burning up my arm and the pain, and it would shoot up my elbow and everything. And all of a sudden, I was questioning my life path and my future, right? Because I couldn't even play without pain, and was going to physical therapy. And then after school, I took a 10-year break to have kids and decided that I wanted to play more. And once I got going, my body was like, hold on a minute, you haven't done this in a very long time. And so I encountered all kinds of funny things. Like there's something called velopharyngeal incompetence. Isn't that a fun word?
That's say that 5 times fast.
I know, it's really fun. The soft palate in the back of your mouth is not strong enough to hold the air pressure. And so you get a grunting sound out your nose. That was a fun one to learn about, but the more I played, I built that muscle and it was just fine. And let's see, another one, the tendonitis came back. I had some shoulder pain. I had all kinds of funny things, some TMJ at one point, and it was mostly just trying to play a whole lot all at once after not playing for a long period of time, right? And yeah, that's about it. What do you want to know about it?
Well, just a lot of times when we get those tendinitis, or well, for me, so as a brass musician, the only injuries I'm usually accustomed to hearing about, especially for trumpet, is anything to do with our reed, right, with the lips.
Yeah, the orofacial stuff.
Right. And less common for trumpet players, at least, and more so in trombone players, is that, like, I guess, rest of body movement that's going on with the instrument. So if you want to just kind of describe real quick for us non-oboists, kind of what in your technique or playing causes that tendinitis to flare up, and then kind of during that first injury with tendinitis, what that road to recovery was like for you.
Yeah. So basically, with a repetitive strain, it just means you're doing small motions or big motions a whole lot of times in a row. And it's causing stress in your tendons or your ligaments. Muscles build a lot quicker than ligaments. And so my muscles got strong quick, but my ligaments had a hard time catching up. And so they get inflamed and get frustrated. It's super common. String players, piano players, woodwind players, people that do this a lot, specifically in the right hand for oboe players, because that's the weight-bearing hand for the instrument. Yeah, and let's see. What else did you want to know? I apologize.
No, you're good. Well, so I guess from a technique standpoint, oh no, you already talked about the technique standpoint, what causes that, but then what your road to recovery was to coming back from that. So let's start from like a physical standpoint. Like, what things did you have to kind of do to get?
Yeah. So physical therapy, the first time in my undergrad, they did something called corn husk therapy. It was pretty fun. You put your arm in a machine and it blows hot corn husks around it, and it's just going to build up, increase your blood flow to help with healing, right? And then you ice afterwards. They have massage, and a lot of it was just rest. Rest was the big thing, was just getting the swelling to go down and not using it again, similar to your face, right? When you had your injury. When I had it the second time around, I also found a fantastic tool. People are really creative because it's common to have problems with your tendons and your thumb joint, whether it's carpal tunnel, arthritis, tendinitis. And this little thumb rest is fantastic. This is the cheap version. They also have the professional expensive version. But what it does is it shifts the weight of the instrument from right here, which was really loose on my body structure, to this joint, which is sturdy. If you push, you can feel the difference. And so the whole instrument would hang there. And I could play if I used this part of my thumb with a regular thumb rest, I could only play for about 15 minutes a day. But once I put this baby on, I could play for 4 hours. And that was the magic trick. So I was super, super grateful. And with the English horn, because that's the big brother of the oboe, it's even heavier. So I have a really good neck strap. It's actually a saxophone neck strap that supports the weight. So I can just use my fingers.
Gotcha.
And I would also say, in addition to the weight of the instrument, the rest and the ice, it would also be important to mention the release of tension. So relaxing my muscle structure, my bone structure, my muscle structure, just having better posture or poise, because posture is very rigid, right? So having more relaxed positioning in my body, my shoulder blades back so I don't hunch forward here, because that tenses up your arms. And relaxing my hand. And really cool trick that a friend taught me was, instead of putting your fingers on the instrument, point a finger down, which is pretty aggressive. You get a really sturdy hold. If you do it pinkies up, naturally, it's a much lighter touch. And if you can carry that into your technique, not only will you have less or no pain, your technique gets faster. And all of a sudden, those runs that felt really labored are just like, whee! They're so much fun. So just the little thin things. Yeah.
Yeah. That's awesome. And how long did it take you, kind of from when that tendonitis started flaring up to when you kind of were able to feel like you got past it?
First time around, I'm pretty sure
First time
that
around.
was the end of my musical career for a while. I actually let it hit me so hard that I just was like, I guess this isn't my path. And I shifted my focus from performing to music education. And the second time around, I just stuck with it. And I said, you know what? This feels like the path I'm supposed to be on. So I'm going to work it out. And it took a lot of effort and patience and maybe forgiveness on the days that I wasn't able to play, because I was like, I just want to practice. But when I was able to step back and shift my attention to other places, then I was able to heal and push through it, and it worked out great. I think one of the greatest gifts of injuries is that you can use those moments to shift your focus and learn different things. I recently, this fall, I had 4 surgeries in my face.
Oh, wow.
And there's no playing an oboe when you have 30 stitches. So I was able to, first of all, outsource some English horn reeds, which was spectacular, and provide those for my students. But playing, I wasn't able to play very much. So I shifted into fine-tuning my reed making skills so I can actually make reeds about twice as fast as I was able to even 5 months ago, and just be more productive in the process. So, if you have a shoulder injury and you're going to the gym, you're going to focus on your legs, right? So if we have an injury as a musician, I'm not able to spend time working on my performing right now. So what other skills can I develop and expand on?
Yeah, and oboe for me is really interesting. Well, I was at a trumpet, in what's called the International Trumpet Guild Conference in Minneapolis back in May, and the principal trumpet player of the LA Phil, Tom Hooten, he kept talking about how he would observe oboists making reeds and how kind of and this blew my mind, but like how half of the time that you guys spend with your instrument is reed making. Am I right?
Yes.
And I'm just curious, like well, this is kind of deviating a little bit, but what role does having a good reed play in like the overall musician health of the oboist? Because I'm sure that probably does play a factor. This is just me, you know, being curious as a trumpet player.
Oh, that is such a loaded question. First of all, if you don't have a decent reed, you're not going to be able to play. If I have a really bad reed, I sound like a 7th grader. It doesn't matter that I have a doctorate. It's just going to squawk and be out of tune and not forgiving in making sound. So you need to have a reed to be even able to play your instrument. Don't get to just pick up the trumpet and it's the same thing every single time. It changes based on temperature. It changes based on humidity, barometric pressure, altitude. All of those things shift how the reed functions. It's pretty cool. I tell my students that reed making is like arts and crafts and whittling meets physics meets magic, because it's very complicated. But if you have a reed that's too hard, it can actually cause some funny things where your muscles get strained. I had a reed that, as I was preparing for a recital, this was my 2nd year in my doctorate, and I had a performance, it was the dress rehearsal before the performance, and I played on a reed that was just a little too hard. And I was working to manipulate dynamics in a very focused way. And so by the time I was done, I was getting really tired. And we were also in the process of doing a recording session for David Maslanka's 10th Symphony with the Wind Symphony at the University of Utah. And it was such a cool experience, but we spent hours and hours recording. And it was a very extensive piece, and there were a ton of oboe solos, specifically one movement that was very exposed, and that requires a lot of quiet playing. So it's very controlled with your embouchure. And by the time I was done, my face was blown. Like, it was swollen. It's probably pretty similar. I know oboe embouchure is very similar to French horn, where it's controlled by these muscles around the mouth, not necessarily the lips, right? Or the teeth. You don't want the teeth to be involved at all. But my lip was totally blown, and my recital was in 1 week. And
Oh,
I
man.
couldn't play for more than 10 minutes at a time. And I was quite petrified. But one read that was just a little bit too hard made it so that I fatigued in the first run through. And then I blew out my face in the next session. So that the whole next week was just painful to play. I iced. French horn player told me I was supposed to use hemorrhoid cream to get the swelling down. And I actually used, there's something called a TENS unit. Don't take this as anything anybody should do, because I just did this on my own. I used it on other injuries, but I actually it shoots electricity into your face, into your muscles, and I put it on my cheeks. I usually do it on like shoulders or knees, and it decreases swelling and chills out your nerves. And so I did that the day before the recital in an act of desperation, and it worked, and I was able to play. So, funny things happen when you're playing an instrument. We push ourselves for the love and the deadline, right?
Yeah. Oh, man. Let me tell you about
tangent.
that. No, that's actually, well, first of all, like I said, that was me being curious, but also I think that what you went into there was actually going to be really helpful for a lot of music educators that listen to the show, and also, I mean, obviously oboists and just the principles are the same of musicianship.
Yeah.
It's just like if you're overworking yourself, something's going to go wrong,
Yeah. For sure.
And with it, well, and it's interesting that as you were talking, I was seeing a lot of parallels with trumpet, right? Because at least in the trumpet world, we always have the saying called, like, you have to have the right tool for the job, right? And so a lead trumpet player is not going to play the same equipment that an orchestral trumpet player is. Or there's always that one person that's like the anomaly and the exception that did it and it worked for them, but that's the exception, right? And so the importance of equipment in injury prevention is something that I've become more and more aware of through doing this show, but also, my own experience with injury. So I'm glad that you went that deep into it, because it's so important. You got to be playing on the right stuff, or else you're going to be overcompensating, right?
Right.
Because that's a principle of any instrument, except maybe piano.
That Maslanka, I would also add that Maslanka journey, because, I think back to that recording session. There was a French horn player that blew his chops during that recording because there were so many huge fortissimo sections, and he totally blew his chops. It took him a good year to come back from it.
Oh, man.
But it was also really loud, and that brings to mind a whole nother level of musicians' health, which is hearing and the importance of wearing earplugs above certain decibels. I have learned when I play with the orchestra at Temple Square, if the handbells are behind me, I have to wear earplugs.
Oh, wow. I would never thought of that.
For 2 weeks afterwards. And my daughter will talk to me. I'll be like, wait, what? Why'd you say? Because I can still hear the handbells for 2 weeks.
She's like, handbells, right?
Yeah, it's a thing. So protecting your hearing is really important. There's just so many levels of health when it comes to being a musician. There's a lot of research in sports psychology and sports medicine to support athletes as they're dealing with health problems and injuries and psychological issues that come up through all of that process. It's not as well funded in the musician world. We don't have quite as many resources, but there's another set of parallels. One of my favorite things I listen to is a podcast called The Sports Psych Show. And it talks about performance in general and, whether you're a coach, whether you're a performer, whether you are under stress. And he interviews coaches of athletes that are Olympians and world-class athletes and from all over the world. And it's really cool to hear perspectives because there's so much correlation between sports psychology and health and musicians. And a lot of the books that are out there for us to use are as a result of sports publications. So
I'm so happy you brought that up. That would be a fun thing
for you to go into.
I'm seriously, so I before I was a musician, we're talking like pre-6th grade, right? But I grew up doing athletics, right? Up until maybe high school. And one of the reasons why I started doing the show, apart from the injury component, was because I've always felt that the athletic mindset and the way that, or I guess resiliency would be the right word. They have a lot to teach us as musicians.
Absolutely.
And actually, going back to what you're saying about athletic injury, I was doing a paper for a performance psychology class here at Brigham Young University last year, and doing a lot of research for it. And I found an article written in a journal that's published by the International Trumpet Guild. And this person mentioned a statistic, or maybe, I don't know if you would qualify it as a statistic, but an observation that in the NCAA has limitation or restrictions, guidelines that these athletic programs have to follow as far as like how many hours a student athlete can work out, how many hours they can play. And then also they've got all these athletic doctors and physicians that are surrounding them, right, to help them stay healthy, right, and give them the best possible chance of success. And I remember reading that and I'm like, holy cow, is there a place for that, or is that even possible in the musician world, especially in the collegiate musician world? Because so many of us, I mean, you remember this super well, I'm sure. You get to college, and if you're like me, you get there and you're like a kid in a candy store because you have all these performing opportunities and you don't know what to do, but you end up doing all of them. And then you end up, not getting enough sleep and all this stuff, and just all for the love of the music and the deadline. Right. As you said, but yeah, I don't know if you have any thoughts about that. I'm just so happy you brought that up because that's like my world too,
Yeah, for sure. I would throw in, there's a book called The Musician's Way by Gerald Klickstein. It addresses how to set your life up as a musician, as a student, as a performer, as a professional. Talks about, basic health and maintenance and balance, and even performance anxiety and things that come up. Another one I would throw in there, Noah Kageyama, Bulletproof Musician.
Yep.
He has podcasts, he has classes. It's fantastic. There's so many gems, and he interviews professionals and spectacular content. I've learned a ton through his programs. And I did actually take a kinesiology class when I was up at the U, which was on sports psychology. And the whole thing, the professor, he was awesome. He let me focus on musicians specifically and take the sport content and find the interrelation and then tie it together with other musical publications that I was able to find that worked with it.
Please go into that. You open that door. You can't close that door on me now.
No. Mostly it wasn't necessarily injuries. It was mostly performance anxiety. Okay. So I focused on the physiology of what happens in performance anxiety. What are some of the physical symptoms? The sweating, the shakes, the stomach problems. There's so many different things. Your heart races, and then also the mental things that can happen with performance anxiety. How sometimes you get into these spirals. You have, like, for example, I had this one rehearsal with Professor Katsianis at BYU, Corey Katsianis, and we're playing, and I played one wrong note, and I was sitting next to this stellar flute player who was just rocking everything she plays. And I was thinking, oh boy, I just played a wrong note. Now what do? I'm going to keep playing. Well, since I got distracted, I played a few more wrong notes. And then a few more wrong notes. And my mind started spinning to the point where I was like, I can't do anything right. Maybe I shouldn't be in school. Maybe I never should have been a musician in the first place, right? Like, it was just this ridiculous spiral of inadequacy because I played a wrong note and I let my mind wander in that moment of performance stress. And I got to the end of the rehearsal and I said, okay, Professor Katsianis, I'm dealing with something pretty funny here. How do I handle the situation better? And I was like, I feel like I really messed up this rehearsal. And he looked at me, he goes, that's funny, because as you were playing, I thought, wow, she sounds really good today. And I was like, wait, we had very different experiences. And he's like, you know what? When you hit those situations, you need to play like a pro golfer. You hit the ball, and if it goes in the woods, you're not going to go hike. You're not going to trek into the trees and find the ball and hike all the way back and then hit it again. You're going to hit the ball, let it go, and make sure you get the next one right. Right? So as you're playing your music and your mind is like, oh no, I played a wrong note. Doesn't matter. Drop it, let it fly, and hit the next one right. And stay focused and stay on task. And that was a huge game changer for me.
Yeah, and that man knows his golf, that's for sure.
Oh, yeah, he definitely does. Yeah, so like the mental limitations and then the emotional things that can happen, right? The triggers when you're performing, where you can feel anxious, you could feel fearful, just all the emotions that rise with that. And also the heightened senses, because as we come under pressure, we hit the fight or flight syndrome, right? And there's this great quote in an oboe art and method book by Martin Schuring. And he says, you know, our bodies are wired so that when we feel that fight or flight kick in, we're ready to fight a bear, right? We're ready to run from an earthquake, but really we're just sitting in a chair and playing an oboe, right? Like you've got all of this energy. So how are you going to use it? Are you going to let time wander? Are you going to let your mind wander? Are you going to be able to stay focused and instead of being overwhelmed by the fear and the intensity, shifting it into a space of excitement and being energized and focusing that energizing, just focusing the energy for good, right? Using it to escalate your performance rather than diminish your performance.
Absolutely. Yeah. Absolutely. And then staying on that performance anxiety, what we were talking about before we started recording, with the role that performance anxiety can play in extra tension in the body and eventually leading to injury. And so
Totally.
what are kind of some of the things that musicians can do to that, I guess, I don't know how to phrase this question, but with regards to recognizing when their body is doing something that could lead to that extra tension or injury, even going into a performance situation. So how can they combat that or ride the wave?
How do you set yourself up? Yes, actually. So I have this slide presentation that I do for all different ages. I've done it in college settings. I've done it for younger kids. But the final slide, it shows water crashing against the rocks, right? When you're crashing and burning on stage because you let the performance anxiety get the better of you. And then there's a surfer on a wave who has figured out how to ride it, right? And that's really it, learning how to ride the wave. But how do we set ourselves up for physical success in performance?
Right.
There are a lot of different methods that have been really helpful. Some people have looked into Alexander technique and body mapping, how to use your body well, find your best balance, your best poise. Some people say yoga, meditation. I played in this one performance with this kid. Holy smokes. He was a spectacular pianist, high school player. He played Liszt, and it was a Liszt piano concerto. And as he played, it was one of those, like, his fingers were bloody at the end of the performance. He was so into it. Before the performance, I'm watching him off stage, and the kid is out there doing power poses, like jumping up and down and leaping and like getting so into it. And that was what he needed to set himself up for success. He needed to use that and get pumped up, versus some other people need to steady and calm. And with that situation, I would say breathing is your very best tool. Because if you can calm your breathing, then you can slow your heart rate, you can calm your blood pressure, you can relax your muscles, you can come from a place of ease as you play, and you can even calm your mind, right? Some of the different breathing exercises they teach, both in sports psychology and musicians' health psychology, like box breathing. So you breathe in for 3, hold it for 3, breathe out for 3, hold it for 3. or 4 or 6, depends on how hyped up you are. Like, how do you get settled? Another way to do it to settle would be to, actually, you can sometimes see Olympians do this. They do power breaths. So really intense breaths in and then blowing it all out. And you'll see that a lot. My last Olympian I saw do it was at the Winter Olympics. It was a skier, and she was power breathing just to like settle and energize and be ready to go. Others will calm their breathing by calming their mind. So one way to do that is a tool where you can notice one thing with your eyes, notice one thing with your ears, and notice one thing that you're touching, and then 2, and then 3. And by the time you're done with that, you are very focused and present in the moment. Or laying down in body mapping and Alexander technique, there's something called constructive rest, where you lay down on the floor and relax and let your spine come to its natural position, focus on your breathing and expansion. And is lengthening and widening are the 2 big words for that one. There's so many different tools. So some people need to pump up and some people need to calm down. And you have to figure out what works best with you and your physiology.
Yeah. And actually, it was interesting. I was listening to something the other day. I think it may have even been like a Tony Robbins seminar or something, but he talked about a Stanford study where they studied those power poses, right? And if you do a power pose for like 2 minutes or something like that, your neurochemistry just like gives you this cocktail of like, I don't know what it is, but it's just, it makes you so much more. Yeah. Endorphins, I guess it is. Yeah. And it just sets you up to be in a mindset where you're set up for success and things like that. So I thought that was a really interesting study. And going back to body mapping, I actually yesterday, as we're recording this, I interviewed Dr. Lee Pearson in the flute world, who wrote the book, literally wrote the book on body mapping.
Right, body mapping.
And so,
because there's one for each instrument.
Right. And so I was curious in your injury recovery, how much that played a role, or if it played a role in helping you get rid of that tendonitis and all that stuff. What was that like for you? Yeah,
it actually played a role in both times. So the first time I was at the University of Colorado Boulder, my professor was James Brody, and he actually runs the Musicians Health Program at Boulder. And it's spectacular. They've built it up, and there's a summer camp that you can go to, which is a week long, and it's devoted to Alexander technique, and it's spectacular. And then let's see, the second time, I guess it'd be later on, I did also do some body mapping with Stephen Kaplan. I got to go have a session with him down in Las Vegas. And then also Luc Vanier, he is an Alexander technique and body mapping specialist up at the University of Utah. He used to run the School of Dance.
Oh, cool.
And he's amazing. So he's a great local resource, and he has weekly classes for locals that want to go check it out. All of those helped significantly. It helped me release my shoulders. It helped me stand with better posture, because oboe players, specifically me, but it's also very common, just tend to hunch in as they play.
Right.
So help me open up, which also expands your breathing, right? Mm-hmm. If you can open up your breathing, you can play better, because the oboe is all about air. Trumpet too. Can't play without the air.
Can't play without the air. You got to ride that wave too. Well, Dr. Bright, this has just been so much fun. This has been so much fun to talk to you. And I know we're kind of winding towards the end of our time here. So there's a couple of questions I want to ask you. First off, one of the things I'm most passionate about with this podcast is helping all musicians who are going through injury find things musically that they can do, right, while they're recovering, because and everybody's situation is different. Some people that I've interviewed, they were able to keep playing during their injury. Some, because it just had to do with different things going on in their body. Some people, like me, for example, like I have, rest is the thing, right? And so but what type of things...
You're doing theory, right? You shifted to a different focus in your music.
Right. And I'm doing other things like learning piano and, composing and things like that. And so there's always something that you can do.
And this awesome podcast.
Right. So in those experiences that you had with injury, what types of things, along with the reed making that you said you focused on, what things helped you get through that from a musical standpoint?
I think really you could go any direction. It depends on what your interests are. You could get into composition. You could get into music history, do more deep study. You could learn how to study scores, right? Spend time actually listening to what everybody else is doing when you can't be the one projecting. I think that one's hugely valuable. Teaching, being able to turn it around when I'm not able to play myself and I'm able to share the knowledge that I've gained. It's very, I don't know, makes things worth it, right?
Mm-hmm.
And it's nice to be able to share and pass things forward. My favorite is always when I can give a student an aha moment that took me 30 years to get to, but they only had to wait 3, right? Those are really good moments.
Those are awesome.
I love those. Just discover what other skills and talents you have.
Yeah. So. And I think that goes for, I mean, obviously those are just universal for any instrument. That's kind of the question I like to ask at the end is if someone came up to you, maybe after an OTS concert and said, "Hey, I heard you on the Trust the Process podcast and I'm going through an injury myself. What advice do you have for me?" And I think that falls right in line with that question. If you have anything else to add of just general advice for musicians going through injury.
I would just say, don't be afraid to learn about it and what you're going through also. Because sometimes, like if you go into just a regular family practice doctor, they're not going to be as familiar with your specific instrument injury, right? When I went to my physical therapist, he actually had me bring my instrument in so he could see ergonomically what I was doing with my body when I played, because that helped him better understand how to treat and help me to build and recover more quickly. So just find things that are specific to your instrument. And there are really great materials out there. There's a journal called Medical Problems of Performing Artists that is great. And you can go in there and find thousands of articles on all different instruments. If you you have the resource right now of the BYU library, and you have access to all of the journals. So you can go in there and put in, trumpet orofacial injury, right? Or just trumpet injury and see what you come up with. You'll come up with hundreds of different topics in all kinds of different journals and publications and dissertations and theses. And there's a lot of different things you can do. You can also focus on your personal health. So spend time eating better and exercising and getting on a better sleeping plan and stimulating your mind in a time that you can't play, right? So see what kinds of healthy structure you can give yourself so that when you get back to playing form, you are in a better space to do your very best.
So true. That's one of my favorite things to talk about on the show is the principle of investment in ourselves, right? Because we spend so much time investing in our musical side of our development, but usually has to take something of, whether it be an injury or whatever, to realize, I probably should be spending time in the rest of my life, Right? There's life outside the practice room. Imagine that, and but that principle of investment in your health and I see health as like having a bunch of different facets to it, right? So I think of musical health being its own thing, but obviously mental health and physical health has all these different things in it, like you were saying, nutrition and things like that. So, it's so important to be doing that while you're getting over an injury.
And if you take care of your body, then your body's better able to serve you when you're ready to do it. Plus, there's this really cool skill that musicians gain, whether they continue with music in their life, in their future as a career, or they just have had that experience. It's playing an instrument is character building, right? It's resilience building, and you're able to push through difficult things. You're able to be consistent. You're able to learn to be reliable and work towards goals, especially in the face of obstacles, right? Which is something you're going to do, like whether you're in the business world or whether you're raising a family. It doesn't really matter. No matter what, you're going to need those character skills. So all around, just keep building, just keep growing. Don't let it stop you.
Yeah.
It's just an injury. It will pass. Work with it, and your life will go where it needs to be.
Totally. Final question, Dr. Bright. So if you had the opportunity to go back in time and take that injury away from you, or those injuries, right? Or leave them there, has it been worth it to you in the time since to leave them there, or would you change that?
Well, what's done is done. I learned a lot, and it stimulated like the bibliography research that I did in my master's. I delved so deeply into musicians' health, and I learned so much. And I'm able to pass that forward to others, and I love having that skill and ability to help others as they're going through it, so that they can find resources more readily than I was able to do at first. And then, I had a pretty serious run with performance anxiety when I picked my instrument back up after 10 years. And that experience made it so that I was able to do more studies in my doctorate. And it pushed me to understand what exactly is happening in my body and why. And now even with middle school students and high school students, as they're processing going out and performing, whether it's as a soloist or in large group situations, they're learning how to process those feelings, and it's not something that has to be crippling, right?
Absolutely.
And I can give them that gift because I went through it myself. So, it was skill building, empathy building, all the above.
Yeah, totally. Well, thank you for sharing everything you shared today. We went some places that I didn't expect, but I absolutely love that we went today, and I think it'll help a lot of people, with their own recoveries and their own musical journeys. For everyone out there in podcast land who has joined us today, thanks for joining us. Make sure you share this and do all those, podcasty things like leave a comment or review and all those things that make it us easier to find for other musicians. And until next time, keep trusting the process.
Subscribe.
Right? Yeah, right. All right. Take care, everybody. Thanks for listening today. I hope you got as much out of it as I did. To see a full bio for our guest today, see the show notes, or go to our website at trusttheprocesspodcast.com. Make sure you share this with a musician you care about who's going through injury, a music educator in your life, or anyone just trying to make it in life. If you have a suggestion for a guest or topic to cover, shoot me an email at trusttheprocesspodcast@gmail.com or send me a message on Facebook or Instagram. Before we go, I just want to give a heartfelt thank you and shout out to my team. Daniel Baldwin, who is my audio engineer, Evan West, who does all music and sound effects for the show, Nate Womack, our website developer, and my sister, Dana Lovell, who created the logo and promotional materials. We wouldn't have the show without them. So tune in next time for another episode of Trust the Process.